Hey Doc, how are you? My name is Dr. Richard Avery, also known as the Effortless Clinic Coach. Thank you so much for joining me here on another video. And listen, if you like the last video, you're going to absolutely love this one, because in this video, what I'm going to talk to you about and reveal to you is how to effortlessly convert your patients, your present patients, into maintenance patients. But here's the thing. I'm not just going to teach you how to turn your patients into maintenance patients. Instead, I'm going to teach you how to create loyal, extremely loyal maintenance patients. And it's going to be completely effortless. Just like everything else I teach, it's going to be effortless. And listen, having a maintenance-based practice for the vast majority of doctors is really, really important. Why is that? Because you know what? Through the economic times that we're going to have, especially right now as we're going through a big valley right now and how the economy is really, really poor, having a base of maintenance patients, really where you have those ebbs and flows, those peaks and valleys of the economic times, when you have a base of maintenance patients, those peaks and valleys start to dullen out, right? It becomes a nice flat line, right? So which means that you'll always have a steady source of income. And obviously, when you have a predictable, steady source of income, it really takes away a lot of the stress, right? Now, in my practice, it's a bit different. I don't really focus on a lot of maintenance patients. And the reason why that is, and for those that have already taken or enrolled in my courses, my online courses, you know that I'm completely inundated with consults and new patients. Because I position myself as a go-to practice. So I'm really just swamped with patients. I'm fully booked. And so having a maintenance-based practice or having a lot of maintenance patients, I just don't have time for it, is really what it comes down to. I don't really have time for it. However, when I had my 8 practices, going back a long time ago, this is a technique that I used that allowed me to grow to, like I said, 8 clinics in less than 2 years. Then I ultimately retired at the age of 39. And for those that are new to this channel or new to me, they don't know who I am, I created this clinic that you see right here, right behind me, and I video documented everything in my free online course called the Effortless Clinic Build course. You can get that enrolled in that course for free. Just click on the link below and you'll see how you can enroll in it for free. But anyways, we'll talk about that some other time. But in my clinic, like I said, I don't see a lot of maintenance patients. If I do see maintenance patients, I tell them to come in every 3 to 6 months, maybe once a year or something like that. Your definition of a maintenance patient may be completely different, which it is for the vast majority of doctors that I coach. A lot of doctors prefer people coming in once a month, which is perfectly fine. And I think that's a great idea to do that because you know what? Number one, again, for just a business standpoint, it keeps everything, you have constant, predictable influx of income, predictable source. But also from a clinical standpoint, you know what? It's probably the better way of maintain the results that you have attained so that your patients can maintain that optimal level of health, right? Because there's going to be hiccups and they're going to have the falls, the trips and hurts and accidents and stuff like that where symptoms may present again. So coming on a once a month basis is probably the better way to go, right? But often, I feel like a lot of doctors that I coach, and even like myself, I hate selling. A lot of doctors hate selling. They hate convincing their consults or their patients to do something, right? But just like everything else that I teach, I'm going to teach you how to effortlessly do it. So again, you never have to convince your consults or your patients to do something. Instead, I'm going to teach you in a manner where your consults and your patients sell themselves or they convince themselves on what you want them to do. And if you do that, you never have to risk sounding like a salesperson. You never have to risk just sound like you're selling to your patient, because that's like the worst thing that you want to do, right? So I'm going to teach you how to do that right now. What I'm going to teach you is based from research out of Berkeley, California, University of Berkeley, and Northwestern. A really, really cool study. And what they did was that they found that if you got people to imagine historical alternatives, they became more patriotic. What does that mean? What the hell am I even saying? All right, let me be more specific. So what they did in this study, they took 2 groups of people. Number one, group A, or group 1, they got those people to imagine what the world would be like if America didn't exist. Whereas in group B, they got people to imagine what the world is like because America existed. So group one, just to kind of reiterate, group one, they got the subjects to imagine what the world would be like if America did not exist. Whereas group B, they got people to imagine what the world is like because America existed. And what they found was that people in group one, group A, where people got the people to imagine what the world would be like without America, it was shown that those people in that group became more patriotic. They became more patriotic than the group that already imagined that what the world is like because America existed. Mind-blowing, right? It did another study, kind of a more of a relevant study, a more present time study. What they did was in group one, much like the other group, what they did was they told the people to imagine what the world would be like, their life would be like, if a certain company, a large company, didn't exist. And then in group B, they got people to imagine what the world is like because that particular company existed. And similar to the first study, group one, where they got people to imagine what the world would be like when that company, if that company did not exist, those people actually became more loyal to that particular company. Mind-blowing, right? So imagine if you were to use that same technique on your patients. They'd probably build much more loyal patients. You'd be build more loyal patients to your clinic, and they turn into maintenance patients. So how can you do that? How can you turn what I just taught you, that study, how can you turn that into applying it to your patients? All right. So we all have this acute care phase where people come in, they come into your practice for whatever reason that may be. Maybe they have a lot of back pain and maybe headaches, or health is not at an optimal level. They may have, they come into your office because they can't play with their grandkids. They just can't do their daily activities. Their quality of life sucks. They're about to get fired because they can't perform their job or whatever. And you get them better. And they're grateful. They're loving you. So it is at this time, near the end, the last third of treatment, what you want to do is you want to get them, or you want to introduce the fact that they should do maintenance care. How can you do that? Well, now that you've built up the momentum and they're really loving your care, one of the things that you can say is simply, you know what, Mr. Smith, I'm glad you're feeling so much better. Imagine what your life would be like if you never found our office. Boom. That's all you have to say. Because when you say that, what will automatically happen in your patient's brain? They will revert back to when that time when before they came into your office, when they were like, they didn't know about your office, right? And they're like, oh my God, what am I going to do? I'm about to lose my job, or I'm desperate, I want to play with my grandkid, or whatever the case may be. They're going to think, man, you know what, doc, if I didn't find your practice, I'd be in so much trouble. I'd lose my job, I'd lose my house, my marriage and stuff, or whatever the case may be, right? For whatever reason that they were so stressed about prior to them finding your practice, right? So right then and there, you're instantly building loyalty in your patient's mind with your practice by just simply saying, Ms. Smith, imagine you never found our office. Where do you think your life would be? They're going to respond, oh, doc, I'm in so much trouble. I'm so grateful. Thank you. Thank you. I cannot tell you how much you mean to me, how much you've changed my life. So, bam. Right then and there is when you start to talk about maintenance care. What I typically say is this, because I deal with severe cases. People have moderate to advanced arthritis, people on the verge of surgery, or at least contemplating surgery and stuff like that. And I say, listen, Ms. Smith, as you know, you have a lot of damage to your knee. There's always going to be vulnerabilities to your joint or whatever. You're going to hurt yourself periodically. That's a function of life. You're going to have your trips and falls, right? What I suggest, the best thing to do to maintain those changes, so that you don't regress back, or you don't have the symptoms, or you don't so you don't go back to where you were before in that same state, is to come in on a maintenance. Maintenance is simply coming in, what I typically say, every 3 to 6 months, just for a tune-up, just to keep everything in check, keep your body in optimal health, keep that knee functioning or that joint functioning, and so on and so forth. And what do they say? Almost every single time they come in and they say, yes, I'm in. I never want to go back to that situation. Because again, it's based on what's called, which I forgot to mention, it's based on what's called counterfactual reflection. Counterfactual reflection. Counterfactual reflection means that you imagine what the world would be like, or your life would be like, your patient's life would be like, if they didn't have your clinic or they didn't know about your clinic. Going back to the studies, counterfactual reflection means imagine what America or the world would be like if America didn't exist. Whereas the group B is called factual reflection. Sorry, factual reflection. So we have counterfactual reflection when something doesn't exist versus factual reflection when something does exist. And when you put someone in the state of mind of counterfactual reflection, they become far more loyal to your clinic. In the previous example in the study, increased patriotism. Okay? Now listen, really, really important to do that because again, when you get people to imagine what life would be like without your clinic, they will be more loyal. Going back to my clinic, as I said, I don't have very many people coming on our maintenance. I don't really push it. I drop it here and there, really more of a casual thing. Because like I said, I position myself as a go-to practice. I have, like I may have already said at the beginning of the video, my average patient base comes from an hour and a half away. So they bypass all the other clinics, all the other therapists in their area that are more convenient, and they come specifically to my practice. So like I said, I'm inundated with new patients. And again, with a high conversion ratio, like I said, I'm swamped. In fact, I had a meeting with a doctor and they asked me what my marketing spend was on a monthly basis or even on a daily, I think it was a daily basis, but we kind of talked about both. My marketing spend on a daily basis is about $30 a day. That's it. $30 a day at my clinic is completely ram-packed. In fact, I have a day that I could mostly just dedicate to consults and ROFs. That's all. My other days are fully booked with new patients. Periodically, if someone's sick or whatever, they call in, they can't make it in, we'll easily fill that up with a new patient, have a space with a new patient, right? So I never really have to worry about maintenance patients. If I want to expand to a larger facility, I might do that. If I have more practitioners in my office, which I'll never do. But if I do that, I'll focus on maintenance. So what I'm trying to say is this. If you have a practice that you want to build a maintenance-based practice or just, again, have that predictable income, use this strategy. It is outstanding. It works almost every single time. And again, the best thing about what I just taught you is that they sell themselves. They convince themselves that they need your care on a maintenance basis. And again, like I said, more importantly, they become more loyal maintenance patients just using that simple technique that I just revealed to you. So use it. It is fantastic. It is awesome. Again, it's counterfactual reflection. Works almost every single time. And listen, docs, if you want to learn more about what I do, how to get your consults to effortlessly turn into new patients, again, where you never have to sell. Again, you get your consults to sell themselves on your care. Check out my online courses. Again, the link is right below here. And if you want to enroll in my Effortless Clinic Build course, where I teach you and I walk you through how I built this entire office in real time, I video documented everything. This has actually become my #1 course that doctors typically watch first before watching any of my other courses, because I show you exactly how my system works. My proven system works every single time, and it'll walk you through. I'll basically handhold you through the entire process as I'm doing it in real time. So it'll blow you away, and I can almost guarantee that you follow what I show you in this course, you too can have $1 million practice. All right, docs, thank you so much for joining me here on this video. We'll see you on the next one.